Stretching is, of course, a term you hear a lot in orthopedics, and people in general use that term a lot. I'd like to discuss today why I think it's often a misguided term and kind of sends the wrong message about what we're trying to do in medicine for orthopedic disorders. When we use the term medically for stretch, we mean a tissue that can be stretched, a tissue that has an ability to get longer. We're typically talking about stretching muscles, of course. We can also stretch capsules, skin tissue, fascia, and to a certain extent we use that term with nerves. However, for nerve tissue, we usually use the word to mobilize. And we can mobilize nerves. There are flosses, there's gliding, but we're not typically saying stretching nerves. And then, of course, for joints, we are not stretching joints. We are moving joints or mobilizing joints. And when we think about these three different examples, we see the difference in other definitions as well. For example, we talk about flexibility for muscles, we talk about extensibility for nerves, and we talk about mobility for joints, actively and passively. So there are differences between those terms. And the reason I kind of perseverate, if you will, on the word stretch with my patients is because I want them to understand what we're doing, because I think that really helps us get the outcomes that we want, is if a patient understands the problem, understands what the therapy is directed toward, and understands the outcomes that we're trying to achieve. So for many patients, we will test, for example, lumbar extension in prone, where the patient is on her stomach and pressing up to get full end range extension of the lumbar spine. We may test this for low back complaints. I may use this test for complaints in the buttocks down to the toes. Anywhere in the lower extremities, I find a lot of people lack lumbar mobility, and restoring that can resolve a lot of orthopedic disorders or symptoms in not only the back, but also the lower extremities. But people will talk about doing their low back stretch. And yes, I will let them use that word, but I will absolutely point out to the person, I'll say, look, we can use the word stretch, I'm fine with it, but I want to point out to you that I don't call this a stretch. And for some patients, I may ask them, well, what are you actually stretching in this position? For some, I'll just tell them, look, the tissue that you're stretching when you extend your low back, when you bend backwards, is your abdominal muscles. Notably, your rectus abdominis is getting the best stretch. And the point of this exercise for you, and this is for 100% of people, I've never tried to stretch someone's rectus abdominis as part of their therapy. You would, if you strained the abdominal muscles, you would have stretching them as part of the therapy, but I've never seen a person come to me with a tear of an abdominal muscle yet. But I tell the people, we're not trying to stretch that muscle. So the point of this exercise is moving or mobilizing your low back joints into extension. So I would call this a low back exercise, a low back movement, a low back self-mobilization, but I wouldn't call it a low back stretch. Now, if I had them go into child's pose or lumbar flexion, usually the point of that also is to mobilize the low back joints into flexion. It's not to stretch the low back extensors. So I wouldn't even call child's pose in that case if I were using it with the point of mobilizing the lumbar joints into flexion. I would not call it a stretch. I would call it flexion of the lumbar spine, a movement, an exercise. So for those reasons, I do point out to people why I use that term. And it's not just the low back. If we're going into repeated dorsiflexion, end range dorsiflexion to see if that ameliorates ankle or foot complaints, it's not a calf stretch. That's not the point of the exercise. It is end range repeated ankle dorsiflexion. Either we're doing it in standing, we're doing it on a step, we're doing it non-weight bearing. Of course, we can go into end range dorsiflexion if the point is to stretch calf muscles and therefore call it a stretch. But I'm naming it based on the intent so that we understand what we're trying to do. Like I said, I think it's really important that clinicians convey to the patients what the disorder is and what we're trying to change. Going into lumbar extension with the point of moving the low back joints and maybe the discs from a posterior to anterior position is a very different purpose than going into low back extension for the purpose of elongating or stretching the rectus abdominis. And this also comes into play a lot when we're talking about the posterior thigh. Many times people think we are trying to stretch the hamstrings. Sometimes we are looking actually at sciatic nerve tension. I'm looking at mechanics. I'm not looking at the flexibility of the hamstrings. So I let people say, I did my stretches, that's fine. But before they say, or after they say that, I will explain to them that it's not really a stretch, but then they can still use that term because it's just so easy for them. But when people hear people talking about, I need to stretch my hip, I need to stretch my hamstrings, they tend to think that most of orthopedics is stretching. And so if I can help kind of curtail that amount of usage of the term, I think that's helpful, because I do want the general public to understand that very few orthopedic disorders are actually muscle lesions or muscle disorders where muscles randomly get tight and need to be stretched. There are very few times when I think we need to stretch capsules, or of course, it's not very often you need to stretch a ligament. Problems with ligaments are usually that they're overstretched. So understanding that mobilizing, moving, exercising is different than stretching, I think is really important.